This is Lecture 6, which we'll be covering Chapter 7, and the topic for this week is single subject design. You'll actually hear this called several different things, and so just be wary that you may hear single subject, small scale experimental, you may hear single case, even single system design. In social work and other fields even call these a few different things. So we're going to call it single subject design, but just again, if you see different mentions, we're talking about the same thing. And we're talking about designs that basically focus on a single subject. This is probably one of the forms of research that lends itself most easily to social work practitioners. So to people that are not concerned with research or evaluation, but that are really worried about whether an intervention is effective with a specific subject, whether this is a client, a family, a program, or even something happening in the community. So single subject design is something that translates pretty well in different settings. So what types of interventions are we talking about? We've been talking about group type of research situations, and in single subject design we're looking at one subject. So for example, let's say you're doing cognitive behavioral therapy with somebody who is bipolar. That is your subject. Maybe you are looking at a training for supervisors to better supervise social workers. That would occur at an agency level. Even in a community level, maybe you want to find out if a training with local police officers has actually helped improve relationships with the community. Then you might include that single police officer. So even though your intervention's taking place in different settings, you see the common theme that there's only a single subject, even if the intervention itself was focused on multiple people. So how do we define it? What is single subject design then, besides being something that's focused on a single subject? So single subject designs are a type of time series design. And hopefully you remember time series design from the chapter on group experimental research designs. We'll look at more what this means, but what this means is it's similar setup is some of the experimental designs, but rather than doing research on a group and doing it in multiple measurements across time, we're just doing it with a single case or a single system. So it's just one subject that we're considering versus a whole group. So what sets single subject designs apart, or what makes it unique? Well, there's three things that you have to know to really know single subject design. You have to understand that there's repeated measurements, you have to know that there's a baseline phase, and you have to understand that there is a treatment phase. So we're going to talk about these and why these are important. So what is repeated measurements? It should be pretty straightforward. You measure more than once. These measurements, though, because you're looking at a single subject, you're looking at how often you're measuring. You could be measuring something in hours, in days, weeks, or months, and you're going to be measuring this both prior to the intervention as well as during the intervention. So you're doing at least 3 of these observations. You're probably going to end up doing more, but you have to do a minimum of 3. We'll look at why in just a second. But in the baseline phase, this happens before you do the intervention. And so, for example, let's say you're working with a patient who's bipolar. Maybe you're looking at the intensity of manic episodes and you measure that 3 times through a standardized instrument. Or maybe you want to document the length of time that a social worker spends with her employees during supervision. Or maybe you want to ask a police officer and ask the community residents the number of positive interactions that they have. And you're doing all of these observations before you've applied any type of intervention. This is the baseline phase. So why do we want to do 3 observations? Why is that so important? Well, we have to define a pattern. If I was to do 1 observation and 2 observation, that third one, I don't know if it's going up. Maybe this second one was a fluke and it really is just kind of a low line. Maybe it's this is the peak and it's going to dip even lower. But you see that you can't tell anything from just 2 lines. You really have to have 3 to establish what we call a pattern. Realistically, you're probably going to do more than 5 or about 5 or 10 observations. It's really the gold standard, but you have to do an absolute minimum of 3 to understand what pattern emerges. And you might have 3 types of patterns: a stable line, a trend, or a cycle. So look at these graphs and tell me which ones do you see might be more of a stable line. Look at which ones might be more of a linear trend. So it's kind of, you could kind of imagine this diagonal line here. Maybe there's kind of a flat line, but somewhere in the middle here, and you see it's kind of right on the bottom or below it. Or maybe it's cyclical. If I'm in a bipolar patient, this might be typical: low, high, low, high. Or maybe it's curvilinear, where you see it increasing dramatically. And sometimes you just might not have a single pattern at all.